Chronic sinusitis is nothing but a chronic inflammation of the inside of the sinuses. So that inflammation can occur for multiple reasons. It can be because of allergies, poor anatomy, the anatomical variants that can really change the inside of the nose. It can even be from previous trauma, but there's going to be some change to the sinus that does not allow the sinus to function the way that it's supposed to. And the sinus reacts by causing inflammation and swelling to the inside of the sinus, and that is chronic sinusitis. Acute sinusitis is more of an acute infection, an acute swelling, so a sudden swelling. So that's going to be more bacterial. That's what can give you that nasty colored drainage that you can get from your nose. Or it can be fungal, it can be viral. So, and that's more of your acute changes. So the acute changes are usually treated with some more of an acute treatment. Antibiotics, nasal steroids, the nasal rinses. But chronic sinusitis usually is not helped by the more acute treatments. You need more of a chronic type treatment, which could be sinus surgery, balloon sinuplasty, and some other things. So balloon sinuplasty is a technology that was developed, and it is literally a small balloon that we will put inside your nose, trace it into the sinuses. We inflate the balloon, and what that does, it stretches the opening of the sinus. We deflate the balloon, we can take the balloon back out, we can even put a little rinsing catheter into the sinus, and we can rinse out the sinus at the same time. So the nice thing about that is it's non-invasive. It can be done here in the office. It can also be done under anesthesia. Because it's stretching with the balloon, there isn't going to be cutting. Without the cutting, you don't have the bleeding. You don't have the pain. You don't have the recovery that you would have with a traditional sinus surgery. So patients who would be good for this is really anybody who has a problem with recurrent sinus infections or chronic sinusitis. Now, there are some conditions that we don't treat with balloons. People who have nasal polyps, people who have large cysts or fungus that's physically growing inside the sinus, stuff that physically has to be removed from the sinus. In most of those cases, we'll still go back to a traditional sinus surgery. But people who have a lot of that chronic inflammation, the recurrent infections where in between infections they seem to clear. But when we order a CT scan on those people, they have these little changes, what we call anatomical variants, that predispose them to having problems inside their sinuses. Narrow openings, extra little tissue pieces that are on the inside, a deviated septum. Those things can also affect the sinuses. Now, a deviated septum is a separate talk, but for the changes in those anatomical variants that are right at the sinus openings, balloon sinuplasty can address that without the traditional cutting. Most patients prefer not to have anesthesia. They don't like to undergo anesthesia. They don't like the wake up from anesthesia. They don't like the nausea and some of the other side effects from having anesthesia. So most people prefer to come in and do something in the office and be able to just stand up and walk right out of the office and go back to doing what they were doing. So after the procedure, I do have people rinse their nose, keeping it moist. I have them use a nebulizer, which we will rinse through some mild steroids to help decrease the inflammation that's inside the sinuses that has been proven to keep them from getting recurrent sinus infections even after the procedure has been done. And normal recovery from a traditional sinus surgery is 2 to 3 weeks. You do have the bleeding, the crusting, and things that go along with the procedure. With the balloon sinuplasty, what we've been able to see is my patients will have a recovery usually from somewhere from 1 to 3 days. I don't put a lot of restrictions on them. They're free to blow their nose gently. I ask that they keep the nose moist, but otherwise I pretty much let them do almost anything that they want.